Nurses of psych wards, what did a patient do that left you speechless? Probably the saddest was a resident I had a long time ago. This gentleman was a World War II vet with Alzheimer's and dementia. Probably once or twice a month he would relive some battle he was in. He would literally run up the hallway and grab you and yell at you to get down behind the sandbags. He would then tell you take his Thompson because it was too heavy for him, he would just use his pistol. Then he would get up and run back down the hallway. This guy was old and seeing him run full sprint like that up and down the hallway during one of his episodes was surreal. I can't imagine having to constantly relive the worst moments of your life where you witnessed and survived the unspeakable horrors of war. In such a situation, would it be wrong to play along? Dealing with ALZ patients, you never tell them number. For example, if they talk about their dead family, you don't ever tell them they're dead, because they can literally go through all stages of grief, until of course they forget again. So in situations like experiencing old war scenes, you don't exactly tell them the war isn't happening, but you steer it in a softer direction. We're sitting ducks here, suck. I'll take the submachine gun and cover the unit while you retreat to the cafeteria for some soft-boiled eggs. God damn it, Johnson, retreat back to the remote access point for the Wi-Fi so we can get your Netflix back up. Can't go without friends. My grandma has had Alzheimer's for a very long time, almost 10 years. Her and my grandfather were not married anymore. There was a lot of bad blood between them, and honestly my grandma was a bitch before MS. And Alzheimer's destroyed who she was, but he came and lived with her to take care of her once the symptoms started showing up. He cared for her until he had a heart attack and had a defibrillator put into his chest. He couldn't care for her anymore. He refused to let her go into a home, but my dad and his sister made the difficult decision to go against his wishes. He stopped talking to any of my immediate family for around 6 years. Then, he got extremely sick, and almost died. He recovered and was put into the same nursing home as my grandmother to start doing physical therapy and get his strength back. My grandmother always remembered him, and they would visit every day, and my grandfather would make her blush, calling her the prettiest gal he's seen despite her messy greasy hair and whiskers, holding her hand, and just sitting there staring at each other. Unfortunately, due to complications, he stopped breathing one night and passed away. My dad and aunt tried to break the news to her gently, and she began to cry and didn't stop for 2 hours. They eventually left, but when my dad went to see her the next day to check on her, she had forgotten. It was heartbreaking, but my dad decided the kindest thing to do was move on and not discuss my grandfather's death with her again. When my grandfather had Alzheimer's, he believed he was back in Auschwitz. It was much kinder to remind him that that part of his life was over. One of my cousins apparently looked a lot like my grandfather's brother. My grandfather would sob and say to this teenager, "I'm sorry I couldn't save you." I tried. My cousin would just say, "I forgive you. It was not your fault." Not at all a nurse, but I worked as a CNA for around 3 years in a dementia unit. For this individual situation, one would have to play along to some extent, but the fall risk would be extreme. I imagine telling the patient that their room was their barracks and that it is safe might work. Where I'm at, nearly every preventive measure can be seen as a physical restraint. Illegal, so this must have been very hard to prevent. Regularly, when a resident had soiled themselves due to incontinence, almost all of us who live to be 80 plus will have some sort of incontinence. You have to make up a scenario to get them to change. Oh my Ruth, it's nearly lunchtime and you're not dressed nicely for it. Let's go see what we have to wear or some variation to get them to their rooms to change. It is very difficult to get a patient with Alzheimer's and or dementia to do anything if you're not playing into how they see the world. One of our patients escaped the ward and managed to hitchhike all the way to Sydney, about 900 km. My grandmother worked in a nursing home years back. I remember driving with her the next town over and seeing one of the patients walking down the street in hospital gown that escaped. It is amazing how much energy a 80-year-old dementia patient has. We would put the patient in the car and drive him back to the nursing home. My granny was admitted to a nursing home as she has Alzheimer's disease but was able-bodied. There was a lady there who befriended her who was in a wheelchair but perfect in the head. She told my granny to take her outside, then went on an adventure, tried to get on a bus and crossed the city before someone realized they shouldn't be out on their own. Granny jailbreak. When my gran was in a locked ward in hospital, the nurses taught us to always look at the shoes. That regular old Jew you think must have been in visiting his wife. That lady dressed up in her Sunday best with her handbag. They all want to fool you and get out. You might think holding the door for them is a great idea, but almost all of the time they're barefoot or wearing slippers, and that's how you tell that they're patients. My granddad was in an assisted living facility. There was one guy in the room across from his who was younger, in his 60s, who had Alzheimer. He would often try to leave and my granddad would keep an eye out and notify the nurses. Usually the guy thought it was Sunday and he'd dress up real nice and head to church, even if it was 3 p.m. on Tuesday, and the church he was trying to go to was in another city. We had a gero psych floor, crazy old people. One night while passing through, a little old lady popped her head out her doorway and said to me, "I could sure use the company of a good-looking young man tonight." "Sorry, I'm not that good-looking." Quick as snot on a doorknob she said, "That's okay, I can't see too well." I didn't join her, but her charisma was on point. Getting hit on by 80-year-olds in the geriatric psych ward whose brains have forgotten what age they are is something they never prepare you for. Some are pretty persistent. Not just dirty old men, dirty old ladies too. Had a catatonic guy who could play the piano like a pro, classic, jazz, ragtime, but otherwise just sat in his chair and stared. Not a nurse, pharmacist. Had one of our clozapine patients miss a monthly meeting to discuss their medication. Called around, found out she was in the ICU having eaten 2 of her own fingers, then visited her mother for coffee, still bleeding. Had a friend tell me of another patient, made a cut in his thigh and reopened it regularly until the whole thing was a scar tissue cavern, by some miracle avoiding infection. Started using his meat pocket to hold pens and coins and anything he could collect in his ward. Nobody knew until a paperclip pierced the side and he finally wound up with an infection that took him to ICU where they found his stash. When I was in nursing school I had a clinical in the state-funded sick ward downtown. I was assigned to sit with this one girl to monitor her behavior. She spent about 30 minutes doing nothing but eating pudding cups with a plastic spoon. She ate like 6 of them in half an hour. Then out of nowhere she very calmly licked her spoon completely clean and pulled her shirt sleeve up before shoving the entire spoon into an incision in her arm near her bicep. Then very calmly said, "Oops." The nurses that worked there didn't believe me. They kept saying I was making it up and that I couldn't have seen what I saw. Only later on, like 4 hours later, it was a 12-hour clinical, the orderly noticed the girl had some blood on her shirt. He took her into her room to change her clothes and noticed that an incision on her arm had dehisced and had been bleeding. Then eventually agreed to send her to the hospital for testing. The X-ray showed the entire spoon, sucked into the fat of her upper arm, through an incision where they'd removed a birth control implant in the week before. Apparently the girl had slowly been picking at the sutures and opening it bit by bit until it was deep enough to fit an entire plastic spoon. The girl admitted that the oops was because it had gotten sucked in and couldn't be pulled out, not because she stuck a spoon in her arm. Totally bizarre. We had a psych patient on our floor that wasn't really crazy, just really confused and unpleasant in general. One night I was mixing his drink with some thickener, and per usual he started yelling about me poisoning him. I explained what it was and that we're all here to help him, not hurt him, and he responds with, "I'm just going to die." His vitals were fine. He was alert, no red flags, and like I said, he was always pretty unpleasant so I didn't think much of it. Sure as shit, he coded an hour later and we never got him back. My man said peace out and fucking faded. The commitment of the lad. Literally the mic drop of a lifetime. That dude was an interdimensional being moving on to his next life. My sister was actually sectioned earlier this year for her eating disorder. She shouldn't have been, but that's a story for another time. And she was right next to the PICU, Psychiatric Intensive Care Unit. One of the nights she heard multiple screams coming specifically from that ward. One of the patients had bit a chunk out of a nurse's leg as they were trying to detain them. They then started eating said chunk. It's crazy to think these types of things happen. I saw a girl bite one of the techs, tear out a chunk, then swallow. Yeah, that will stick with you as well. Not a nurse, but I was a patient in a psych ward. The ward was sectioned into 2 sides based on case severity. I was on the less severe side. One night, an incredibly tall, Somewhat muscular man escaped his room on the severe side, got through a door that was supposed to be locked, got into the less severe side, and into my room. I woke up, sat up, and saw him standing in my doorway. He asked in a shaky voice if I was alright. I hesitantly said yes, to which he responded by getting a look of terrified horror and screamed I knew it. You can see them too. Don't let them get you. Before he was dragged away screaming by security. Guess you're protagonist now. The sad thing is, he really seemed to care for you. My experience of people with psychiatric emergencies is that they often are really nice people. I work on an ambulance in an area where a third of my patients are usually being transported for psychiatric reasons. They often call themselves because they see that either their medication isn't helping or is making their symptoms worse. They'll tell me that they have thoughts of hurting themselves and or others and want to be treated before they lose control. They will have manic episodes sometimes and need to be restrained, but the vast majority of my patients going through something like this are doing everything in their power to remain calm and collected, and more importantly not hurt others. When I was a student doing a placement in a maximum security unit, a serial rapist was getting meds, made a silly joke. The nurse said, "Oh, stop that." His response was, "I've heard that before." We had a psychopathic rapist with reinforced illusions of grandeur. He was obsessed with a female nurse, convinced that she fancied him back, but her job prevented them from being together. When told that this wasn't the case, he thought that the male nurses fancied her and were jealous of him and that the female nurses wanted him for themselves. He would try to seek her out alone, once tried to lure her to his room where he had a barricade waiting to block them in while he raped her. He admitted this, but insisted that it would have been consensual. That failed, so then he tried to get her fired instead with accusations. He bit himself and scratched his back, blaming her for them. The idea of that guy getting out still terrifies me. He has no remorse about any of his past crimes and basically thinks that the victims were lucky that he abused them. Was interviewing a guy in psych ward and he was complaining about how he couldn't have any whiteout, a liquid eraser for typewriters, because he was on suicide watch. Claimed it was stupid because if he wanted to kill himself, as he pointed out, he could use the drawstring from the blinds to hang himself, or he could use his pencil to stab himself, use a typewriter metal bar to off himself. I agreed it was silly to hold back the small bottle of liquid whiteout. When I relayed the convo to my instructor about how silly it seemed due to him having several other ways, she replied that he proved to me that he had been considering ways to kill himself and that's why he was able to come up with so many so quickly. He never did get his whiteout. I had to stay for a while years ago and they had done a good job at eliminating ways to do it. It's kind of amazing that they had blinds at all. We also only got crayons. Even the hooks to hang stuff would fall down with underweight. The most dangerous thing was the shower curtain and toothbrush, I guess, but they stood in the bathroom while you took one, as well as take the toothbrush when you were done. When I was in, they had the things you described, but the toothbrushes were bendy and the shower curtain was velcroed on. There was a shower in every room, 2 to a room, with a swinging pillow door that was also velcroed on. When you came in, you had to give them all of your toiletries and they would take inventory of them and give you specific items when you asked. Funny but unrelated story. I was still in high school when I went in, and I had to read To Kill a Mockingbird for my English class, so I brought the book so I could finish it. They didn't let me bring it in because it said to kill. 60-something old woman would come out of her room every so often at night topless and holding out her saggy breasts, saying in broken English, my nipples, please, for the children." 40-something woman would sneak the shower mat out of the bathroom to put under her bed because she was God and we were stealing her power by electrocuting her vagina every night. The floor mat apparently stopped this from happening. A severely schizophrenic woman used to tell me that my name was the worst fairy tale lie that she ever wrote in the 2 Bibles for her daddy. When she was angry with me, she would yell at me and say, "Get out of here, fairy tale book. I wish I never wrote you." That same woman attacked some nursing students who were attempting to use tissues over lollipops to make ghost props for Halloween. She didn't seem to like this and while trying to hit them was yelling, "You idiots. You can't make ghosts out of lollipops." Again, same woman but different group of nursing students brought in several pizzas for an end of semester party. The woman then walked up and down the tables looking at the pizzas. Then out of nowhere she started throwing the pizza and yelling, "What's this supposed to be? Some kind of pizza test?